So generally, there are two types of treatment that are what we call evidence-based treatments for ADHD that we know work well, that have been studied, behavior management. And the second type of treatment is evidence-based and is known to carry positive outcomes, are medications. Ultimately, for most children with ADHD, we want them to have both types of treatments. When you look at children over time, the best outcomes are for children who received both types than if they only received one type alone.
The American Academy of Pediatrics recommends for the first 6 months, kids have that behavioral intervention first before any type of medication is introduced. Why do you think that doctors have been so eager to give these children, these very young children, medication so quickly?
In conversations I've had with pediatricians about this question of early prescription, what I've heard most of the time is that there is an issue around access to behavioral treatment. Pediatricians say we don't know where to send these families to learn these techniques, these behavioral approaches. And so sometimes I think that can be a reason that families and clinicians feel like, oh, the symptoms are maybe severe, maybe some very significant. The child is getting kicked out of preschool or things like that, and we want to start maybe a medication to help. Overall, we know these medications are safe long-term, but for young kids, they are more likely to have short-term side effects such as being irritable or moody, or they're going to start getting upset more or crying or even hitting more or things like that. And when we see that side effect, we obviously stop the medication.